So the benefits that the SuPER Clinic have offered to me as a clinician, thinking about for our clients in the community teams, are really about a culture shift. In our current teams, we have very limited resources for access to psychological therapy for psychosis, and yet we are working in a context where there's loads of really brilliant groundbreaking research into therapies for psychosis. So we have loads of brilliant new treatments that we know are good, but those treatments really aren't trickling down into everyday practice. So the SuPER Clinic has offered a brilliant hub for us to start thinking about what those studies can tell us, what resources we need to be kind of thinking about in community teams. And really impressively, the SuPER Clinic has offered the capacity for training for 40 of our community therapists to train in an intervention called Feeling Safe, which is a new and novel intervention that's supported by a brilliant randomised controlled trial, and has some really good evidence for supporting people with psychosis to improve in their symptoms, but also their general recovery and well-being. So the SuPER Clinic has provided some brilliant training opportunities, but it's also provided a real culture shift in outcome measures. So again, routinely in everyday practice in community teams, we do some routine outcome measures with our clients, but it's not standard practice, and it often is in research. So the SuPER Clinic has really shifted the culture in our teams to start using routine outcome measures with our clients. And that really helps clients to track their progress, their recovery. We can have a dialogue about that. It really helps to motivate clients. But it also really helps us as services to start tracking kind of what's helpful and what's not so helpful about what we're offering. And that can also feed into the research that we can do as an organisation on what helps people.